Wonderful. And you're making a huge impact in this area for these kids.
Thank you.
So let's start. Andrew, have we got any questions through yet? No. So let's just start talking about diagnosing. If I don't know if that's the right word, but I presume that ADHD comes in a huge spectrum of different.
It is a spectrum, you're right. Yeah. And most pediatricians are trained to diagnose ADHD. So it is a spectrum. On the lower end, if you will, it's just inattention. So people who just can't pay attention, but they're not hyper, they're not restless, they don't shake or move a lot. They're just still, but their mind is worrying and moving into many, many directions, so they cannot focus. And then on the other end of the spectrum, they're extremely hyper. They cannot sit still for 1 second. They're constantly jumping around and moving around. And most kids are somewhere in the middle. Sometimes you do see ADD children and very, very hyper ADHD children, but most of the kids are in the middle, and we call them combined. So that diagnosis gets the term combined ADHD, combined type. And when a doctor diagnoses it, there's not like a test to pin the diagnosis. It's mainly we get behavioral questionnaires from the teachers, from the parents. We observe them in the office. So we get more like a testimonial, but an objective testimonial from these authority figures in the child's life to say, yeah, the child kind of behaves that way all over the place. It's not just at home. It's not just at school. It might happen at church or daycare, other places. And then we kind of come into the consensus that most likely the child has that label. And it's just a label of the symptoms that we're seeing. So it's not a test. Okay. Yeah.
So in light of that, are there physical changes, say, in brain chemistry and things like that that go along with it? Or
there are. In Western medicine, we don't look at that. There's not like a battery of tests that will prove that these numbers match ADHD. You can do a PET scan, which is very expensive and not easily found, right? So if you go to Dr. Amon's clinic, we have one here in Atlanta and there's one in San Diego. You know, you can get a PET scan and get the diagnosis of ADD based on the PET scan, but it's not the routine way of diagnosing. So there's not a blood test or any specific test that we can do. But what I'm seeing when I run my functional tests is these children do have vitamin deficiencies, mineral deficiencies. They might have excess in copper, for example, and low zinc, low iron, low vitamin D. They might be very low in omega-3s. They might have a microbiome, which is the bacteria in their gut that's out of sync and not a very healthy microbiome. So we do see that. But we have to be, it's beyond the diagnosis. It's almost now we're looking to see, well, what is off balance in their physiology that we can rebalance, and maybe that'll help minimize the symptom.
Okay, we have a question. Does it ever just go away by itself?
It's a great question, and I believe it can go away. I don't know if it by itself is the right assumption. I think people change habits and do things differently that then result in different amount of symptoms. So for example, a child who grows up and decides, I'm going to get fit and exercise, I'm going to get my sleep right, I'm going to eat healthier, and all of a sudden their ADHD symptoms are gone. It's not all of a sudden. So it's been a transition, and it's happening because they've changed the way they live. So yes, it can improve, and it can look like it's dissipated by the time a person reaches adulthood, but it's never really gone unless we're doing the right things.
Okay, next question. At what age can kids be diagnosed?
In America, we're diagnosing at age 4. So 4 years old, we can make the diagnosis. It seems aggressive to me, but there's such a push from the schools and the daycares and the parents that the DSM-5 community and the American Academy of Pediatrics decided to go ahead and lower the dose, the age of diagnosis. So they're allowing from age 4 to diagnose and treat.
There confusion or between just normal child behavior, maybe a child, has a different kind of personality, and then a tendency to want to treat that as a ADD or ADHD diagnosis?
Yeah. So children who've experienced trauma, for example, whether they've had abuse or some kind of physical trauma, they'll have PTSD. Okay. And when a child is dealing with PTSD, they have a lot of anxiety, a lot of anger, a lot of irritability. And some of that behavior can be construed as being ADHD, but it's not a clean ADHD because there's all these elements of anger and the anxiety that's underpinning their behavior. So good psychologists, psychiatrists can help differentiate, what is it? Is it ADHD or is it these other things? Because it is important to find out and not give them the wrong medication, by mislabeling them. Some children have sleep apnea, and because they're not getting sleep during the daytime, they're acting more hyper because that's how they can keep themselves awake and keep themselves from falling asleep. So there's a lot of other confusing or mimicking diagnoses, and it's part of my job as a doctor and job of all pediatricians to take a good history and to really understand what's going on in that child's life.
What age do you prefer to diagnose? Do you have sort of a better
Yeah,
range?
I think I prefer 6 and up. I feel like they've matured a little bit more from the 4-year stage, where they're still toddlers at 4 years, and if we expect them to behave like a more mature child, it's not reasonable. But 6 years, they're in school and we can compare them to their peers a little bit more. And I feel like I get better, a truer diagnosis. If I say your child has ADD or ADHD, I can get a better idea from my questionnaires that it's really true and it really applies. Yeah.
I've heard that autism and ADHD are related. Is that true?
It's only true in that children with autism can also have ADHD symptoms, but not the other way around. So if a child has ADHD, that doesn't make them more susceptible to have autism. But if a child is diagnosed with autism, they can have other psychiatric labels such as ADHD or anxiety or, basically other labels. Yeah.
Is it hereditary?
ADHD is very much hereditary. Yeah, it is. But the environment plays a big role too. So there's always an interaction. I believe in something called biochemical individuality. And we are always an interplay of our genes and our environment. And that's where we can really impact the disorder or the diagnosis, because we can manipulate our environment in such a way as to minimize the expression of the genes.